I just sent you the link.
All right. Just came through. Okay, let me go verify it's there. Good to go.
Okay, thank you.
You're welcome.
Chris?
Oh, there's Chris. Yeah, good.
Good afternoon. How y'all doing?
Good,
Okay.
good. Good you're here.
They're starting the live stream, and as soon as they post the website, we'll be ready to go.
You're ready
Dr.
to go.
Club is
son.
posted to the website.
All
You're
right, you can go ahead and start, Dr. Warren.
Okay, so let's call the meeting to order at 1:05 p.m. Present are Dr. Burnett, myself, Dr. Rochelle, Dr. Doms, Dr. Collada, and Tracy and Patricia. Are there other members here? Looks like we have 9 participants. I'm not sure if I got everybody.
We have I have 4 of our staff and myself, and 4 of y'all.
Okay. So we don't have any old business on the agenda today. Well, we have to approve the minutes from the last meeting. Did everybody get a copy of those?
So moved.
I do have one correction on number 2 on LSBEP. It should read LSBEP suggested that a medical psychologist cannot, and add this, cannot receive prior approval to supervise potential licensees, comma, unless the MP is licensed by LSBEP. In other words, they can't get the approval of the supervision plan. LSBEP isn't going to grant that until after the fact, which puts the supervisee at risk of having that turned down. So we can add that, delete the next 2 sentences, and then keep the last sentence. Committee will monitor how LAMP addresses this issue. That's the only correction I saw.
Then I'll
Did y'all
withdraw
get-
the motion and make a motion to approve the amended minutes.
Have a second?
Second.
Okay. All right, all in favor?
Aye.
Okay, on new business, 3 MPs asked me to put nurse practitioners on the agenda. This is something we've discussed previously. It actually came up early on after LSBME assumed regulatory control of MPs, the issue of consulting, collaborating, receiving referrals from MPs. But as time has passed, of course, and as there's an acute shortage of primary care physicians, NPs are becoming the go-to provider in many situations, particularly in the rural parts of the state. I understand in North Louisiana, particularly 2 of the requests came from North Louisiana. You know, our statute does not allow us to consult and collaborate with MPs. We have to do it with a physician, and this will require a change to our statute. And I don't know if it requires a change to the nursing statute or not, if that is pursued. I haven't even looked at their statute, but it is, it is an issue. It's becoming more difficult. Many people are using urgent care centers now for primary care, and a lot of those are manned by NPs. So it's just something that's concerning I guess a number of the MPs in the state, and they've asked what we can do about it. I don't know that we can do anything about it. It's going to require LAMP or somebody to advance some legislation to change that if that's what they choose to do. Do you have any thoughts about that, Van?
Warren, I have a comment I'd like to make. I know because I actually collaborate with some NPs already, and the law does say it's a physician that they collaborate with. But the question that I really have is whether or not they, meaning the NPs, are going to pursue further, scope of practice kinds of freedom, in that they have moved from being supervised by physicians to collaborative physicians. And my understanding is that they may introduce legislation again this year for removing collaboration as a necessity at all. So it may be a moot point if they pass legislation that says nurse practitioners no longer need a collaborative physician.
Again, I'd like to comment on, consulting with is different than being a collaborating physician with an NP. In a collaborative agreement, you are responsible for defining the scope and activity of the NP. We generally allow only physicians to do that, and they define what they can do. And basically, it's something that they do only if the collaborating physician can do. So, for example, if you were to hire an NP in an MP's office, in the MP office, technically, what are you going to collaborate with them on?
I think y'all are misunderstanding what Warren was asking. Am I right, Warren? The question was not about the nurse practitioners collaboration, but our law says that our referral for us, we must collaborate with a medical physician. We can't accept a referral from a nurse practitioner. Is that what you're talking about, Warren?
Yes.
Okay.
All right,
Yes.
so you don't want to be the collaborative physician for an NP. That's what I'm trying to get at.
No.
Okay.
No. So
No,
for
our hands are kind of tied now. We get any number of calls from NPs about referrals and questions about medications and things like that. But, our law requires us to collaborate with a physician licensed by LSBME.
Yeah, I think that I guess what I'm saying is, what do you all want to do? Maybe a clearer, help us to help you get what you want to do. Because if it's just to receive, consult, and work with NPs, then I think that NP is going to have a collaborative practice physician at the present time, and you don't need to be that. And you can treat the patient and just make sure that the nurse practitioner knows what medications you're prescribing, and they are making sure that there's no drug-drug interactions to the other medications that may or may not be prescribed for that patient for whatever reason. And I think we can, if that's all you want to do, I think we can certainly work to amend to allow the rules, or if we need to change the law to allow that. But I think the goal was, in the initial phases, was to make sure that whatever medications you were using, and somebody else who was treating the whole patient would know all of the medications and be able to avoid drug-drug interactions and other problems.
Well, that kind of gets to the next question I had about that, Van. If I, for example, received a referral from an NP and treated that patient, am I able to assume that her or his the NP's collaborative physician is, that collaboration is adequate to cover me and the requirement to work with a medical physician?
Well, again, I think if we need to specify that, we can. I think the key is understanding what you want to do with the rules, if you want to change the rules or the law, and understand that, you know, we have no way of knowing what the legislature will do about whether or not nurse practitioners are independent practitioners or continue to remain as collaborative practice arrangements with physicians.
Right.
I think it's if they continue to do that in a collaborative fashion, it is safe to assume that they are working with the physician on the other side of the patient's needs, not necessarily the psychological needs, but certainly all of the other medical necessity needs that need to be addressed. But again, again, we have to be careful how we throw the terms around so that we don't mix our decision making and base it upon one definition of collaboration when we really mean consultation and management of drugs in the patient.
Okay, good. And I think you kind of inferred, Robert, that the NPs might be coming forward with legislation this next session, which is what I've heard, to do away with the collaborative physician arrangement.
That's certainly what I've heard.
Okay, so that may sort of put another twist on it then, if they're no longer collaborating with a physician. Another twist for us.
That would require changing the law.
Yeah, okay.
But assuming that they don't get that and they still are required to collaborate with a physician, is there any way for us to change a rule without changing the law?
I think because if they still have a collaborating physician, it would simply be defining the rules in the light of the law of how APRNs and physicians work. Now, that would change. If that changes in years to come, we would have to redefine it for both your law and your rules. But if it stays the way it is right now, and Patricia, you can tell me if I'm wrong, I think we can make the interpretation that the collaborating physician is still ultimately in charge, and the high-level decision-making and problem dealing with will be done in collaboration between the APRN and the physician, and you guys continue to do your work and just notify them of the drugs that you're changing and the medications that you're using so that they can deal with so that the nurse practitioner and the collaborating physician can avoid any problems with other medications.
So
Okay.
I think where the rubber hits the road practically is if I have, as an advanced medical psychologist, if I get a referral from a nurse practitioner, like I require a written referral from the physician. So if the nurse practitioner signs that referral, I think that's the gist of it, where we don't really get the medical doctor's not signing the referral. The nurse practitioner would be signing the referral.
But they're all, at the present time, there's always a physician involved in the collaboration of their current practice that is the quote higher authority, if you will.
Correct.
I think if that was clarified in rules, that would make everybody happy. We could accept a referral from a nurse practitioner with the understanding that their collaborative agreement will, take care of what's in our law, that we have to have the consultation part with the physician.
Yeah, that would go a long way toward solving the problem, at least as it exists now.
I say if we could do that, that would be a very positive step forward. And then it doesn't require us to open up the law. If the nurse practitioners gain independence, then that's a different story. We cross that bridge, we come to it.
Yeah. Okay, the next item on the agenda is changes to the Practice Act, which we're kind of beginning to touch on. we're into year, let's see, this would be year 14 now of our Practice Act with LSBME. And we need to make some changes. Some of it is just housekeeping stuff, kind of tidying up some a little ambiguity in the law. We did not anticipate some things when we wrote the law. There were only 2 states that were licensing prescribing psychologists at that time. So we didn't consider MPs coming into Louisiana from other states. There just weren't that many of them at that time. It doesn't really make sense to me to require those people to go through LSBEP as they would have to do now. That's the starting point. So, you know, that's something we need to look at. I hate to admit that we missed something kind of glaring. As it stands now, anyone who's licensed by LSBEP can become an MP. So if their licensed specialty is in IO psychology or experimental psychology, they can apply to be an MP if they've never had a course in abnormal psychology as an undergraduate, never worked with a patient, never seen a patient. That was we intended it to read with a specialization in clinical or counseling psychology, and we just missed it. So those are some things that we need to attend to. There are different ways to, and I say we, I'm talking about LAMP. Our committee does not do that. But one of the things I wanted to ask you, Van, was because LSBME is a regulatory body, does LSBME take a position on any legislation proposed by a professional organization, regardless of, well, let's just say a group regulated under LSBME to start with?
Well, we do not take positions, we give information. So maybe we cannot say it's good or it's bad. We cannot advocate for it. We can simply say, these are the good points, these are the pros, these are the cons, and the legislators make the decisions based upon the reasons that they make their decisions, unrelated to us. So basically, we are prohibited from lobbying, and therefore we only give information.
Okay, that's what I thought. I knew you spent a lot of time in the legislature during the session, but that was my understanding, that you weren't promoting a professional agenda, that you were simply guarding, if you will, the regulatory control of it. So, for example, if the physician's assistants decided they wanted to propose legislation that would allow them to do minor surgeries, you would offer the pros and cons to that legislation without taking a specific position on it. Am I right?
That's correct. That is correct.
Okay. Now, if LAMP proposes changes to the Practice Act, are the members of this committee allowed to testify if we clarify who we are testifying for or on behalf of, or should we just stay away from that entirely? Do you see my question?
I do, and we have an expert in that area who happens to be on our call today. Ms. Wilton, you want to talk to them about that question?
Sure. You shouldn't testify as a member of your advocacy organization because that blurs over appearance-wise into your
role as a public servant, as a member of this advisory committee, and it can raise concerns and questions. However, everyone is entitled and allowed and permitted to testify as an individual. So if you go to the legislature and you want to testify as yourself on behalf of yourself, based on whatever expertise that you have and so forth, you are perfectly free to do that. But when you start representing yourself as testifying on behalf of an organization or entity, in this particular case, it's going to cause a conflict because you regulate the practice in your capacity as an advisory committee member, but then you are also testifying either for or against legislation in your capacity as a member of an advocacy group, and that would more than likely be problematic.
Okay, I thought that might be the answer. I didn't know about testifying as an individual though. So that's
Yeah.
acceptable. Okay.
Yes, you can go and say, I am Dr. T. Barry Brazelton. I'm a pediatrician. I have this testimony to offer you in favor of this law. I think it's going to be a great law, or against this law. Just not blurring the lines of the public roles that you have, one of which may be as some sort of leadership in an advocacy organization, as well as a dual role as a public servant who is prohibited from lobbying.
Gotcha. Okay, we'll make that clear to LAMP, but the members of this committee now know that.
You mentioned something earlier, Dr. Warren, that I want to get clarified because it's starting to come up. If a medical psychologist is in Louisiana, do we have a reasonable expectation, or do you as an advisory committee advise that it is best if the consulting physician is in Louisiana to treat the Louisiana patient?
Well, that has come up before, and I think we've assumed that the physician needs to be in Louisiana.
I thought that's what we did before, but somebody is quoting Glenn and saying, "Oh no, I can have a consultative physician that's not in Louisiana." And I just wanted to make sure. I thought we did this before, and we want to make sure that I want to get it right.
Yeah, the only exception to that is the military. We have made exceptions for active members of the military, and we have a couple of applicants today that we have accepted their supervision, which comes through active duty military physicians.
Now, let me say this to you. We technically do not regulate active duty military when assigned to a military post. So, for example, if the MP is working at Fort Polk and the MD is working at Fort Polk, we don't get involved in even licensing them as MPs. If,
Right.
however, the MP decides to open a little sideline business nights and weekends, then they would have to meet the criteria to do what you all have done, because now that's not their military assignment. So I'm not sure it's somehow we're seeming to blur this, because we do not regulate federal employees and federal institutions like VA, military bases, and TDYs to military bases for that kind of stuff. We would only regulate them if they step off base to have an outside practice. And then they would have to follow all the same rules that you do. So you really aren't making an exception to the military. They don't need us to even license them. Now, some of the military contractors are wanting them to be licensed. But again, it's really what they're doing and how they're doing it that makes a difference to us.
So, and the way I understood it when we did it before, Van, for some active duty members of the military, was that the LSBME board had to approve an exception on our recommendation. But that would mean, I would guess that each board would have to do that, since the makeup of the board is changing over time. Is that correct, or how does the board look at that?
Well, the board is, anytime we deviate from the rules, the board has to approve it, okay? But you would not be deviating from the rules if the military, and again, we do not, I guess what I'm trying to say is we do not have to give an MP prescribing license to a MP who is solely employed by and solely provides services to federal beneficiaries in a federal installation. We don't have to do that. Okay. Now, if they have to get that, okay, and they don't want to have, and again, how will he work outside of the system? We can give those things, and we may have to make it clear that when they step outside of the military, because they may open an office at nights and weekends to treat non-military dependents, then they're going to have a licensed Louisiana physician to be there. And so we would have to go back to following the laws unless you believe that the military collaborative physician can now extend his outside, because that's where it's going to get kind of funny now.
Yeah, I would think that wouldn't really be possible.
Well, I don't either, but again, that's what I'm trying to say. I'm not sure we have to worry about. I mean, if you want to grant them a license, but we don't even have to grant them a license to do what they do in their military work.
Apparently, and I'm just judging this from one of the applications, is if they get the advanced practice certificate, that allows them extra privileges, at least in one setting, one of the military bases. I don't know. I don't know if there's a uniform regulation about that or not, but that's what I'm seeing, is that these people that are in the military want this advanced practice certificate.
And a lot of those are because the contractors that they work for are requiring it, okay? But again, I think we have to make it clear to them that it is not a needed requirement unless they step off of the military service, federal installation to provide services to non-military or federal dependents. And then they got to follow the rest of the law like anybody else.
So let me throw this at you. Medical psychologist works at Fort Polk under the supervision of a military physician, or collaborating with a military physician. He doesn't work off-site base, but somebody, a patient that he sees or has seen, doesn't know that he isn't regulated by LSBME, and they file a complaint with LSBME against him. What happens if LSBME doesn't have any regulatory control over it?
It's just like if it was filed a complaint against somebody who was working at the VA. We are not, it's non-jurisdictional. We don't get involved. They have to file a complaint through the military because they have their own complaint and disciplinary system different from ours.
Okay, gotcha.
So are we blurring the lines when we accept an applicant for advanced practice who is out of state, seeing out of state patients, collaborating with a military physician? And we're granted a license based on that. Does that kind of blur those lines even more?
Well, you really have no jurisdiction to do so. I mean, if that's what you want to do, we can ask the board to waive the rules and do it, but I don't see the need for it.
Right, I agree with that, yeah. It's unless, like you said, they're going to come into Louisiana and practice independent, like with civilians.
I agree with that too, because we really don't know what that person is doing. if they go off-site and open an evening private practice, we're not aware of that. Of course, they'd have to be in a state that recognized medical psychologist. But I don't know. It just seems like we're kind of treading into some iffy territory here. I'm wondering if we ever should have done it in the first place, but it wasn't explained to us at the time. I think Rob was the executive director then, and he just said, yeah, we ought to do that for them. But now that I really understand that there's no regulatory control at all, I wonder why we are doing it. I don't know. What do you think about it, Darla or Rob?
Darla, I'll let you go first.
I kind of look at it like we're licensing them to practice medical psychology in the state of Louisiana. If they're not in Louisiana, then wherever they're at and whoever they're working for, that's who's responsible for that, not us. They're not practicing as a medical psychologist because they can only do that here. So the military is responsible for them when they're on their military base. And if they set up a practice somewhere else, either the psychology board or the medical board, they would be responsible for that because we don't license people in other states. Like, I see it as more like we license you to do this. This is what your license allows. If you're doing something outside of that and you're not in Louisiana, then that's someone else's jurisdiction. You can't use our license to do that anyway.
So
I'm
should we
thinking
even
about it
license
wrong.
anybody that's not in the state? It's not going to practice in the state?
I mean, I know when I was on the psychology board, we licensed psychologists in Louisiana who also had licenses in Texas, Alabama, Kentucky. And I didn't feel I was responsible on the psychology board for their practice in Kentucky. So maybe I'm looking at it too simplified, but.
I have to agree with Darla. As a physician, if I want to practice in Florida, I have to go over to Florida and get a license to practice there. If I want to practice in Texas, I've got to go over to Texas. Now, that, of course, the exception is during these emergencies like Katrina and so on and so forth. But I would think that in some respects, by licensing someone who isn't practicing here, isn't under your supervision or regulations, that there may be some liability in that. Why would you license someone who you have no control over? Why would you license someone who you really are not having them serve under your regulations that everybody in the state has to follow? So I too may be looking at it in an oversimplified fashion, but if they're up in Maryland and that's where they're practicing and they want to get an advanced practice license from here, and then they start attempting to use that up in Maryland, there's something real fishy there.
That's a good point. I mean, yeah. Go ahead.
Does our application ask a question about intent to practice in the state?
No, not that I'm aware of.
And I think one of the things that could be happening here is people who live out of state are using it at the license as, a feather in their cap. They're actually maybe not even practicing medical psychology, but I'm living in a state that doesn't have the license and getting, they go through the clinical psychopharmacology courses and they preemptively try to get a license in the event that something, they move here. Or I think one of the applicants mentioned through an email exchange that it would look good on as an expert witness. There's some ulterior motives I think some people have for getting these licenses.
I guess the concern I have is I've seen people go to some of these online universities and get credentials, and you kind of wonder about the validity of the credentials. So Chris, you're kind of referring a bit to what I'm thinking about, which is they come here, say, oh, I'm an advanced practitioner, but they aren't necessarily following any of our guidelines because they don't practice here. So what kind of reputation does that give Louisiana?
Let me ask this question. As a medical provider, through the medical board, I mean, I'm assuming most physicians in the military keep a license in some state. Does the
They
medical
don't have
board?
to. They don't have to. I mean,
I
they
don't
don't have to.
But I'm just saying, I assume most of them probably do. Does the medical board frown upon that? Someone being licensed in Louisiana, but they're active military and aren't based in Louisiana?
Well, if someone, for example, is licensed in New Jersey and decides to take a job at the VA hospital in New Orleans, we don't license them in Louisiana. Okay.
Right.
So they can come and work on their federal installation with their New Jersey license. We don't regulate them in any way, shape, or form. Now, we have had, for example, some independent contractors contracted to the military who wanted to do radiology for Fort Polk. We said you do not need a license to do so. You're licensed anywhere because if you're only going to be doing it at Fort Polk, you're going to be fine. You don't need a license in Louisiana. Are you reading outside of Fort Polk for hospitals in the rest of the state? No, we're independent contracted to the military. Then what happened is the contractor service that was issuing the contract wanted them to be licensed in Louisiana. So we said, okay, you're welcome to apply for a license in Louisiana, but understand that unless you go outside of Fort Polk, we have no regulation over you and we have nothing else to say about it. So again, I think it's really, if somebody needs it, that's fine. But again, I think we ought to have a justification, to make sure that they're getting a license for valid reasons. And you seem to allude to something that we probably ought to be discussing in the executive session about what this person is doing. So we want to make sure that we do that in the proper venue. But again, we do not require those physicians that work at VA or Fort Polk or Barksdale Air Force Base to be licensed in Louisiana. What we do to help out the military dependents who want to work off base is we have an expedited licensing process to get them to work off base. But on base is not required unless it's a contractual requirement of the agency that this contractor is contracting with. I hope I'm making myself clear to y'all. If I'm not, I apologize. Tell me what I can clarify for you.
No, it's clear to me. I mean, are we ready to adopt a policy about military applicants before we go into executive session?
Well, I don't know that you have to adopt a policy. I mean, it's just a question of there's really no effect of saying you don't need this license. But again, making sure that if they choose to get the license, they understand that they have to use that license only in Louisiana, outside of their military practice, and they must comply with all of the rules, and they can't use their military consultant if that military consultant is not treating patients outside of the federal installation.
Well, so I guess the question is, do we even want to grant them a license?
Well, that again, we can talk about that when we get to the individual case.
Okay, all right.
So, along those lines with what you were just saying, when you communicate, I don't remember, it's been so long since I got the license. Is there a formal letter sent from the board to the applicant saying you've been granted advanced practice? If so, then there could be some language added to explain those situations with military folks.
We can certainly do that if the situation warrants it.
Okay, we've got one more item on new business, and that's notification of applicants regarding the status of their application. There's been some postings on the LAMP listserv, and I've got phone calls about my application has been in for quite a length of time, and I haven't heard anything about it. Or my application, I believe, was reviewed, and I haven't heard anything about it. And there is a portal now, am I correct, that they should be able to track the status of their application?
Yes, sir.
Okay. There were two people that we reviewed back in August that we deferred on. And both of them have told me they have never heard anything from anyone about the status of their application.
Well, again, we usually, I can certainly address that. I have no way of knowing anything about that at this particular moment. But again, I can tell you at this present moment, right now, because I just ran the report, there are only 2 pending applications, initial licensed applications for medical psychologists in the system, 2. And I can't tell you their names in public, but I can tell you we have 2. And I don't think that either of those are what you're talking about. But again, we can look into it when we go into executive session and delve into it a little more.
Okay, that's fine.
And Dr. Colati, that's initial and advanced practice, only 2?
Only 2. Our licensing people are working hard. They are really knocking it out. I mean, if people, again, I can tell you that anybody can check their license status anytime they need to. All they have to do is go to their portal, and they can find out what's going on. They can find out the name of their licensing analyst. They can email their licensing analyst or phone their licensing analyst. And, we have that capability all the time.
Okay, good. So are we ready to move to executive session? We have a motion.
So moved.
Second. Okay, all in favor?
Aye.
Okay, if you'll give us a few minutes, the ladies will make the transition. We'll leave the public sector portion of the meeting to return to make any motions at that time. So the ladies will be moving us over right now. Click your join the new room, and we'll be seeing you there.
Tracy, I'm gonna leave you outside of executive session.
Yes, ma'am.
Grace, are they still in the executive session? Tracy?
Oh, I'm sorry. I was talking to you. I was on mute. I said, yeah, they're still in executive session.
Can you
Jacinta
get me
said-
in there?
I can't. I'm texting Jacinta. Let me tell her to put you in.
Thank you.
Okay.
Are we back in regular session?
Yes, sir.
Okay. Robert, do you want to make that motion?
Yes, I would like to make a motion that we table / defer today's applicants until a later date.
Second.
All in favor?
Aye.
Okay. And you want to make the second motion?
I will.
Okay, Darla.
I want to make a motion that we carry a request to the full medical board asking for a rule change that eliminates the requirement that someone applying for an advanced practice as a medical psychologist must maintain concurrent licensure with both LSBEP and LSBME after they've received their MP license and it's in good standing.
And that's an emergency rule change?
Yes.
Okay. Did we pretty much nail it, Patricia, or are we off base?
Yeah, no, yes, sir, that's it.
Okay,
Second.
so second, Chris, all in favor?
Aye.
So motion passes. So Patricia, will you be able to let us know how successful or unsuccessful you are?
Oh,
I'm sure
yes, of
everything's
course.
fantastic.
I'll keep everybody closely posted.
Okay, thank you.
You're welcome.
Any further business today? You ready to
Make a
adjourn?
motion for adjournment.
Second.
All right, all in favor?
Aye.
Aye.
Thanks, everyone. Appreciate it.
Thank you.
We stepped into a minefield, but I have confidence that Patricia's going to get us out of it. Thank you.
No pressure, no pressure.
Thank you.
Thank you, Patricia.
All right. Bye-bye.
Bye now, everybody.